Hi everyone, my name is Hania, and today I'm going to be talking about autism spectrum disorder. So, what is autism spectrum disorder? So, it's a range of challenges regarding social skills, speech, repetitive behavior, and nonverbal communication. Autism looks different on the individual. So, some may be nonverbal while others can speak, some can have disabilities intellectually while others may not, and some can also live independently while others may require support. Individuals with ASD sometimes mask their symptoms in order to be accepted or meet social expectations. And this is kind of a reason why some adults are um, diagnosed with ASD during adulthood rather than childhood because they mask their symptoms and it's more difficult for doctors to be able to diagnose. And this is kind of more common with women. So ASD looks different on everyone. So doctors look out for two main symptoms to make a diagnosis. So we have difficulties with social communications and interactions, and we have repetitive and restricted behaviors. So for difficulties with social communication and interactions, we have three criterias: social interactions, communications, developing, maintaining, and understanding relationships. So for social interactions, um, the individual would have difficulty starting or taking turns in conversations. They would have difficulty understanding social cues and what others are thinking or feeling. And they have difficulty sharing emotions. For communications, they usually have trouble making eye contact or trouble understanding body language and facial expressions. And they have trouble regulating the tone of their voice. So sometimes you would notice they would have a monotone voice rather than showing expression or emotion with their voice. Um, Next, we have developing, maintaining, and understanding relationships. They tend to feel overwhelmed in social situations and have difficulty expressing feelings and seeking emotional comfort. They also have difficulty making friends and difficulty understanding boundaries in personal space. So now we have restricted and repetitive behavior, which is the second main symptoms, and we have four criterias to it. So we have repetitive movement, speech patterns, or play. So the individual would be stimming or making repetitive body movements to regulate their emotions, such as rocking or spinning, lining up toys in a row, spinning wheels, or repeatedly flipping switches. And they usually imitate another person's speech or repeat words or phrases. The second one is insistence on sameness and need for routine. They usually are distressed when there are minor changes to their plans or routines, and they usually have ritualistic behaviors such as watching the same videos over and over again. And they have a need for routine, so they must have the same exact daily schedule. The third one is an intense and highly focused interests. So they have an extreme knowledge or interest in specific or niche topics, and they have a strong attachment to certain objects, for example, toys. And lastly, we have under or over sensitivity to sensory stimulation. So they usually have an unusual sensitivity to light, sound, texture, or touch, and they lack sensitivity to temperature or pain. And they usually have sensory seeking behaviors such as visual fascinations with lights or movements. So for treatments, we have four kinds. We have behavioral management, speech, occupational, and physical therapy. So for behavioral, we have applied behavioral analysis, which is a treatment that's typically used to reinforce behaviors, promote social development, and help develop daily life skills. Early ABA is used for very young children with ASD. Next, we have speech therapy, which is crucial for people with ASD since they have deficits in social communications. This will improve their communication skills so that they can better express their needs and wants. And for individuals with ASD that are nonverbal, they use the use of gestures and sign language or picture communications are useful. So next we have occupational therapy, and that's used for sensory integration and motor deficits. This can help with tasks that involve fine motor movements, such as using utensils or writing. Lastly, we have physical therapy, and that's used to improve gross motor skills and sensory integration issues. So, similar to OT, PT is used to improve the individual's ability to participate in everyday activities, but PT focuses on the improvements of walking, sitting, coordination, and balance. So, ASD has a lot of myths about it. So we have a couple on the slide. So the first one is autism can be cured. There are no cure for autism as long as it's a lifelong neurodevelopmental condition. However, symptoms can be managed and improved with therapy. The most common myth is that autism is caused by vaccines, which there are no scientific evidence that proves that. Vaccines do not cause autism. There's no correlation. Um, Another myth is that autism is caused by poor parenting. Autism is a neurodevelopmental disorder with biological and environmental factors, and autism only affects children. Um, it's a lifelong condition, so even though it is diagnosed during childhood, adults can also be diagnosed with autism. Thank you so much for following along. If you can learn more at arabmentalhealth.org, and yeah, thank you so much.